Psychology. Definition of psychology. In nursing, it helps us understand how a person reacts to illness, pain and hospitalization, so that we can provide them with personalized care. Personality. Dynamic aspects of personality. Defense and adaptation mechanisms. Emotional states. Driving and behavior. The carer-patient relationship. The professional relationship. Personal attitudes in relationships. Transfer and counter-transfer. Definition of psychology. Personal development. Definition of psychology. Psychology is the science that studies psychological phenomena, mental processes and human behavior in their cognitive, emotional and relational dimensions. The aims of psychology. Psychology seeks to understanding human behavior, explain human reactions, anticipating certain behaviors, helping the individual to adapt. The branches of psychology. In nursing, it helps us understand how a person reacts to illness, pain and hospitalization, so that we can provide them with personalized care. Definition of psychology. Personal development. Personal development. Human beings go through several stages of development throughout their lives. For a nurse, understanding these stages enables them to assess whether a patient's development is normal or pathological. A. Psychomotor development. It relates to the nervous system's gradual control of the body, gross and fine motor skills, muscle tone, body awareness. Application enables the monitoring of developmental milestones in children, e.g. head control, walking, or the loss of independence in older people. In patients, certain psychomotor delays or disorders can affect their independence and their ability to move around, wash themselves, eat, etc. B. Emotional, or psychoanalytic, development theorized primarily by Sigmund Freud. It is based on the psychosexual stages, oral stage, anal stage, phallic stage, latency period, genital stage. Application: understanding the possible setbacks a hospitalized patient may experience, e.g. an adult who becomes dependent, or demanding again, like a child. In a care setting, a mood disorder may manifest as anxiety, aggression, withdrawal, emotional dependence, etc. C. Intellectual, or cognitive, development theorized by Jean Piaget. It describes how intelligence develops, from birth to adulthood, sensoromotor stage, pre-operational stage, concrete operational stage, formal operational stage. Application: adapting your communication. You wouldn't explain an injection in the same way to a 4-year-old as you would to a teenager. These functions may be impaired by illness, pain, medication, or neurological or psychiatric disorders. For nurses, understanding the psychosocial stage enables them to adapt their communication and care objectives. For example, a teenager does not react in the same way as an elderly person. D. Psychosocial development as theorized by Erikson. It shows that identity is formed through crises throughout life, e.g. trust versus mistrust in infancy, identity versus confusion in adolescence. Definition of psychology. Personal development. Personality. Personality is the relatively stable set of ways in which a person thinks, feels and acts. It gives each person their own unique way of responding to the world and to others. It is the result of both innate factors, temperament, biological predispositions, and acquired factors, upbringing, life experiences, culture. In clinical practice, personality has a significant influence on the relationship with the healthcare professional and on treatment. Definition of psychology. Personal development. Dynamic aspects of personality. The psyche is dynamic, driven by conflicting internal forces. The unconscious, the part of the psyche containing repressed desires, memories and drives, which are inaccessible to conscious awareness, but which influence our actions, e.g. slips of the tongue, dreams. La pulsion, one poussée énergétique d'origine biologique qui orient l'organisme vers un, but x, pulsion de vie survie, pulsion de mort to destruction. Repression, a mechanism by which the psyche pushes representations deemed unacceptable or painful back into the unconscious. Motivation, an internal or external force that triggers, directs and sustains behavior, e.g. a patient's motivation to follow their treatment. Definition of psychology. Personal development. Defense and adaptation mechanisms. When faced with the fear of illness or death, patients unconsciously use defense mechanisms to protect themselves. Denial, refusal to acknowledge a painful reality, e.g. a heart patient who refuses to take their medication, saying that there is nothing wrong with them. Projection, attributing one's own unacceptable feelings to others, e.g. an angry patient who accuses the nurse of being aggressive. Regression, a return to childish behavior in order to elicit protection, e.g. crying, refusing to eat on one's own. Sublimation, transforming an unacceptable impulse into a socially valued activity, e.g. art, sport. Definition of psychology. Personal development. Emotional states. Nurses must be able to recognize and acknowledge the emotions of the patient without responding in kind. Emotion, a stable and lasting emotional state, e.g. love, gratitude. Emotion, a sudden and fleeting physical and psychological reaction to a situation, e.g. joy, sadness. Fear and anxiety, reactions to real or imagined danger, fear of the operation, anxiety about the future. Anger, a reaction to frustration, or a sense of injustice, often linked to a feeling of powerlessness in the face of illness. Distrust, an attitude of reserve or suspicion, which requires the carer to be completely open in order to build trust. Definition of psychology. Personal development. Driving and behavior. Behavior comportement ist l'action observable de l'extérieur, x, agita, crier. La conduite englobe le comportement ainsi que la signification, que le sujet donne à ses actes. En soins, l'infirmier cherche toujours le meaning hidden behind challenging behavior. In clinical psychology, we observe verbal behavior, what the patient says and how they say it. Nonverbal behavior, eye contact, posture, facial expressions, tone of voice, restlessness or stillness. Behaviors such as avoidance, aggression, dependence and independence. For nurses, a patient's behavior provides insight into their psychological state. It is important to observe them without judgment and to consider the context, pain, receiving a diagnosis, family conflicts, etc. Definition of psychology. Personal development. The carer-patient relationship. The nurse-patient relationship is at the heart of nursing care. It is both personal and professional. It is based on communication, active listening and respect. Main objectives: help the patient to express their needs, fears and questions. Build mutual trust. Encouraging adherence to treatment. Supporting the patient through their experience of the illness. Key principles. 1. Respect, dignity, modesty, beliefs. 2. Empathy, understanding the patient's emotions without losing one's objectivity. 3. Active listening involves: listen carefully, observe, rewrite. Definition of psychology. Personal development. The professional relationship. A professional relationship differs from a friendship or a family relationship. It has specific characteristics. It focuses on the patient and their needs, not on those of the carer. It has a framework: place of care, opening hours, institutional rules. She respects the patient's confidentiality, dignity and privacy. The carer must maintain appropriate distance, neither aloofness nor emotional closeness. Healthcare professionals use their technical and interpersonal skills to care for patients, whilst adhering to a code of ethics. Definition of psychology. Personal development. Personal attitudes in relationships. Certain attitudes on the part of the carer help to build a good relationship. Active listening, paying attention, paraphrasing, showing that you have understood. Empathy, putting oneself in the patient's shoes, without identifying with them. Respect, do not judge people's choices, beliefs or behavior. Authenticity, being sincere, consistent, and not putting on an artificial act. Availability, showing the patient that they matter, even when time is limited. Conversely, certain attitudes can damage the relationship: judgment, impatience, aggression, indifference, and excessive familiarity. Definition of psychology. Personal development. Transfer and counter-transfer. Transference transfert ist un phénomène psychologique par lequel le patient projette sur le soigneur des sentiments, des attentes ou des attitudes qui appartiennent en réalité à son histoire passée, par exemple, à ses parents, à d'autres figures d'autorité. Transference is a psychological phenomenon whereby the patient projects onto the care provider feelings, expectations, or attitudes that actually stem from their past history, for example, relating to their parents or other authority figures. Persécuteur, etc., sans que cela corresponde à la personne réelle du soigneur. Cela influence la relation, attachment excessive, dependence, aggressivite, idealization. Example in healthcare: an elderly patient, who is excessively obedient and affectionate towards a young nurse, unconsciously mistaking her for his daughter. The counter-transference refers to the carer's emotional reactions towards the patient. The carer, too, may experience feelings such as sympathy, irritation, fear, pity, attraction, etc., linked to their own personal history. For the nurse, the challenge is to recognizing one's own internal reactions. Do not act solely on the basis of these emotions. Maintain a professional, calm and caring attitude. Example in healthcare: a nurse who gets unusually upset with a demanding patient, because he reminds her of a member of her own family. Definition of psychology. Personal development.